gradual opening. This is not, we're not, turn the switch on and then everything goes back to where it was. So a long answer to tell you I don't know yet.
So do you have a deadline or a date that you hope to make a decision by for schools?
Well, we're going to make a decision as early as we can, and we're trying to signal to people exactly what is going on. And again, as we look at new data coming in every single day, at the same time we're looking at this data coming in, we are in the process of preparing how we get back. And we've said, a lot of this depends on what tools we have. And we're frantically trying to get these tools in. We're trying to get the personal protection equipment in. That's not only important for what we're into now and protecting everyone, it's important as we try to see how we could protect people as we would move out and as we would try to get back to normal, whether we have that. The testing that we have talked about, and you heard Lieutenant Governor Dr. Acton talk about today, how well that testing comes on and how fast it comes on is going to also influence when we can start back. So a lot of variables, a lot of things going on, and we're just going to have to see.
Thanks.
Hi, this is Jessie Bulmert with the Inquirer. I have a question about patients who are also healthcare workers. Do we know?
I'm sorry, for what?
Oh, I have a question about patients who are also healthcare workers. Sure. I guess, do we know if they're kind of spread out across the state or if there's any concentrations, or is there a reason why we haven't had data on like either a county or a hospital level about those individuals?
I'm going to ask Dr. Acton if she knows. I don't know the answer.
Thanks.
Hi, Jesse. We have been reporting, I know, healthcare worker cases, and I'll look into at what level of granularity. I understand what you're asking there. And so we've been keeping track. Again, we know it's probably at the tip of the iceberg, even amongst folks who are healthcare workers. Not everyone has been tested, especially in front lines on nursing homes. Some of the staff, once they know that there's infection there, some tests are reserved and they assume it clinically. Again, the frustration in all of this remains two things really, nationwide and worldwide. The lack of protective gear. I mean, we talk about you can't do elective surgeries if you don't have the gear to gear up in, and we're saving the gear for everybody on the front line right now. It's very, very frustrating, I know, for everyone. And the testing similarly, we are doing everything we can to use the tests, the few tests we have, as accurately as possible, but those numbers just aren't that revealing until we have more widespread testing. Just to piggyback off the governor, I do want to say we're going to give you an elaborate framework that's been developed around recovery. But there are a couple key things, and I'll point people, if you want to sort of, again, this is a hint of things to come. There's a really great New York Times article today by Aaron Carroll. He's the incidental economist, but he's a physician in Indiana. Pretty famously blogs on this, and he's also referring to something. There was something done by Scott Gottlieb and a whole team of researchers around the United States. It is by the American Enterprise Institute, but I think that and some of the work done at Johns Hopkins and then around the world, you're seeing all the best scientists talk about how do you responsibly keep this from spiking again. We see in Singapore today, as Lieutenant Governor said, the fact is most of our population is still susceptible, and we have no real idea of the prevalence of this infection yet. The good news is we have a lot of tools that we've put in place. The second we have those tests in our hand, and some work we're going to be doing over the next few weeks to get at those numbers better. I think Ohio is going to have one of the best. It really is one of the best frameworks I've seen, but it's based on these concepts. It's based on having enough testing, because we really need to be able, we want to know who's sick, and we want to let the people who have recovered go back to their lives in a really responsible way. So that is so key. We need to have that PPE, and the hospitals have full capacity. This whole time, we have been rebuilding an unprecedented response and triage system so that no hospital in Ohio is overwhelmed as we've seen some small hospitals become, and that our whole system could take on what's going to be an ongoing onslaught of patients with COVID. This isn't going to end, even when many of us return back to work, because our population is not immune and that there is no vaccine. People will still be sick, and so we need a healthcare system built up. We need a public health system built out more robustly so that we can really contact trace effectively. And finally, we really need to see these numbers show that we're on that downslope. We really need to see 14 days of decreased cases, because it's a long and this very terrible virus that is like the ideal.
I want to begin today's briefing by just extending once again our deep respect and admiration for our caregivers, particularly our hospital workers, our alternative care workers, those working in nursing homes, large and small, all throughout the state of California. Those are the real heroes of this moment. And we need to talk more about care for our caregivers. We have talked rhetorically about meeting their needs as it relates to providing psychological first aid by extending our hand of appreciation, a good word, kind of support that we all need, a little bit of moral support. But we need to do more than that and provide the kind of support that increasingly is needed for a workforce that is deeply stressed out, deeply stretched. Families that have been broken apart because their loved ones are spending 24 hours a day, 7 days a week, attending to the needs of others and not able to come back home, in many cases sleeping in their cars overnight, in other cases unwilling because they've been exposed to this virus to even want to expose their family back at home and are spending their own money to go to a motel or a hotel overnight. We've heard countless examples of these stories. And instead of continuing to absorb those stories, we wanted to do something more and do something better. And so I'm really pleased today to announce an effort in the state of California to directly support those caregivers, those healthcare workers, those frontline heroes, by providing them vouchers and stipends, and in many cases for low-wage workers, 100% reimbursable costs at hotels all up and down the state of California. We currently have an inventory over 150 hotels that have been part of a bulk purchasing of room program through our Department of General Services. Some of the nicest and finest hotel chains in the world are participating in this program, providing deep discounts to the state of California. And we will extend those deep discounts directly to our caregivers. And in other cases, again, for low-income workers, we'll provide 100% reimbursements so that they're allowed to stay closer to their patients and provide them the opportunity not to worry about being out of pocket or worry about exposing their families or, God forbid, worried about another night sleeping in their car so they can stay closer to the needs in their communities. Let's remember, people are commuting for an hour, hour and a half in the good days. And the idea that you're doing a 12-hour shift and at 2, 3 in the morning have to drive all the way back home only to get right back up and do a double shift early in the morning. That's not appropriate, and that's not right. We need to do better for these workers. And so I'm very pleased that we have put together a new website, caltravelstore.com. Caltravelstore.com is the site that will have the list of these 150 plus hotels. Every day we're getting more hotels to participate in this and make available these vouchers for those individuals. Lower wage workers, richer supports, the higher wage workers, deep discounts across the panoply of our healthcare workforce. I want to also thank the airlines that have also stepped up. United Airlines, they reached out to us and they said, you know what? We read about the Health Corps website that you put together, all now 86,516 individuals strong. 86,516 individuals have signed up on our healthcare site. And United Airlines called and said, if you have folks that are traveling into the state that want to be part of that Health Corps, we want to take care of their travel costs. 100% round-trip tickets, no matter where they are at any point of the globe, not just across the United States or within the state of California. And I just want to thank United Airlines for stepping in a big way to help that workforce address the other anxiety, which are travel costs, not just accommodation costs, hotel costs. No sooner, by the way, than United reached out, and we got a call from Southwest Airlines, Alaska Airlines, and Delta. Those are the 4 airlines that met this moment. And let me thank not just United, but once again, Southwest. Let me thank Alaska Airlines and thank Delta for committing to do exactly the same. And so that information is also available at our website, and we couldn't be more grateful for their largesse and their support. By the way, that's an open-ended commitment until this crisis passes. And our commitment to the accommodations and hotels extend accordingly. So more care for our heroes, for our caregivers at a time when we need to be there for them so that they can attend and focus on the needs of the most vulnerable patients throughout the state of California. And also, I should just extend those that are in the workforce that may have been impacted and tested positive, healthcare workers, for COVID-19. We also are providing these sites, these hotel rooms, as isolation rooms, as quarantines for those individuals as well. And those that have also been exposed and are worried about their health and their process of getting back results in their tests, that can't go to work until those test results come back. These are also hotel rooms that are set aside for you. And so I just want to thank all our partners in that endeavor, and also all the individuals. We did one of those Zoom calls about 10 days ago, and universally, this was the #1 ask for the people that participated in that call. And these were representatives of our doctors, the California Medical Association, our Nurses Association, Bonnie and her team, April, SCIU, and Bob, and Dave Regan, and others that all participated in that, and they said this was one of the top asks of their members and one of the most important things we can do to help with their stress and ease their anxiety, also their financial burden at this time of crisis. So that's the announcement we wanted to make up front. In addition to that, I want to just extend a few updates in terms of data and new information that's come in, as we do on a daily basis, in terms of the total number of individuals impacted and currently testing positive for COVID-19. 18,309 is the official state count of those that have tested positive. 492 families torn apart. These are not statistics. Behind every stat is a real person, real lives that have been torn apart. 492 lives lost now in the state of California, 50 other families torn asunder yesterday that lost their lives over the course of the last 24 hours to this virus. 1,132 individuals are in our ICUs, and 2,825 are now hospitalized in the system. Let me just put that into statistical terms in terms of percentage increase. The 2,825, the total number of hospitalized, is roughly 4.1% increase from yesterday. And here, very importantly, is a statistic in terms of percentage drop that I haven't been able to communicate in any of my daily briefings, and that is the total number of individuals in the ICU. That number of 1,132 represents a drop of 1.9% from yesterday. One data point is not a trend. One data point is not a headline. So I caution anybody to read too much into that one point of data. But nonetheless, it is encouraging, and it just again reinforces the incredible work that all of you are doing to practice physical distancing. The stay-at-home is working in the state of California. That curve, it has been bent in this state, but it's also again been stretched. And we continue to be vigilant and do more every moment of every day to procure the physical assets in terms of our alternative care sites, as well as the appropriate levels of PPE. We made a significant announcement about that last night, and that includes ventilators that we confidently have secured within the hospital system and on our own state cash to meet the needs based upon our models and projections. And on that front, let me just reinforce a number that I gave a week or so ago. Well, let me go back. About a month ago, I reminded all of you that we had 7,587 ventilators that were identified within our 416 hospitals. That was the number that we advanced in the beginning of this curve. We said that the hospitals, like the state, were going to do everything they can to procure even more ventilators, refurbish ventilators, get supplies donated, and the like. Just a week ago, I announced that they had done just that. No longer 7,587, that the hospitals had 11,063 ventilators, which was good news. Today, because the hospitals every day are doing everything they can, like the state of California, to procure more ventilators, today they have 11,747 ventilators. I make that point to make this point. I think some people have expressed some concern about California's willingness to extend a hand to New Jersey, New York, Illinois, D.C., to Maryland, to Nevada, and to other states across this country by lending ventilators to deal with the crisis at hand in those states. We thought it was the right thing to do, but I also want you to know it was the responsible thing to do as American citizens, from a moral and an ethical imperative to save lives, all of us Americans, but also responsible in this context. The hospital system alone is currently utilizing 31.89% of all their ventilators. Forgive me for the precision, but I think you deserve precision. 31.89% of those ventilators are currently being used, which means over 8,000 ventilators are not being used within our hospital system. That does not include the number of ventilators the state of California has in its storage facilities and the number of ventilators we have been sending out over the course of the last number of months. So I just want to secure any anxiety that people have and also remind you of this. Ventilators are different than personal protective gear. They're consumed personal protective gear, and they are destroyed, with, again, the exception of N95 masks, which we are now able to reuse because of the new Battelle system that we have procured that will be operational by April 20th of this month. But ventilators can be used over and over and over again. And when those ventilators are used to save lives in those other states, we have the firm commitment from those states to send them back to the state of California. And why? Because, again, our curve is not bending like other states. We have stretched our curve, giving us a little bit more time. But we can't just sit on assets when we can save lives and help our fellow Americans. And so I just want to clear up any anxiety in that space or any ambiguity or any misinformation, to be candid with you, that's been expressed in this space. I am not, though, naive on this front, that we live in the aggregate. I give you those numbers, and that does not necessarily reflect the reality in each and every county in the state of California. But within the hospital system themselves, they have a remarkable mutual support program and strategy. In the state of California, led by David Duncan, is responsible for our state's effort. They check in every single day to all the county health directors to check in on their current supplies, current need. And our ongoing resolve is each county should at least have 2 times as many vents as they need on any given basis, on the basis of how we then procure and process the redistribution or distribution of those assets. And so that is something every morning we check in and we update, and that's the protocol that we've advanced from the beginning of this process. That's what EMSA does. That's what Dave Duncan does. And that's what he continues to do, and proud of his work and proud of the work of the team that we have assembled. By no stretch am I naive as well that things can change and that we need to double down on our procurement and double down on our redistribution of these assets. That's a dynamic reality. We're well aware of that reality, and we have strategies to address that. And I just want folks to know those strategies include regionally pre-positioning these ventilators as well, which we've done so that we can save not just a day on the delivery, but quite literally hours on the delivery as those assets are called upon and needed. PPE, again, we mentioned yesterday the significant capacity now for California to procure hundreds of millions of units of protective gear, substantively N95 masks and surgical masks, but also coveralls, gowns, gloves, shields, and the like. I know that people are out there wanting and demanding more PPE in real time, not just our healthcare workers, but our grocery frontline employees, our grocers. We recognize that our IHSS support needs more. Their teams need more PPE, and just want folks to know, soon as we get deliveries, we get them right back out. Quite literally, hundreds of thousands went out yesterday. Every day, we're pushing these things out. The announcement we made yesterday was not immediate. It's over the next few weeks. So over the next few weeks, we're going to start seeing our numbers increase significantly, and the redistribution of those assets in real time throughout the state will also significantly improve. So that's a little bit of an update on the PPE side, ventilator side, update on the overall numbers in the state of California, and some good news on those ICU numbers. But again, just 1 day, 1 point of data. We'll check in tomorrow, in the course of the next few days, to see if those numbers continue to show positive signs. I also want to just make a point to those that are anxious on another topic about the delay of the fishing season in the state of California. I may have lost half of you, but if I was watching, I'd start paying attention right now. I'm passionate about fishing myself, and I am getting inundated by people that are concerned that we've canceled the fishing season. That is not the case. We are not canceling the fishing season in the state of California. We just want to delay, not deny that season. But here's why, and I hope it makes some sense. At least from our perspective, it does, and I hope I can extend a capacity of understanding, at least on the way we're thinking about this. We had 2 small counties call us up that have some of the greatest fishing in the world, quite literally in the world, not just in the United States, Mono and Inyo County. And they have fishing season coming up, and they're just worried about being overwhelmed by everybody that has a little cabin feeder that want to get out and get on those streams. There are derbies that are out there, people that are that wait every year, the end of the season, for the beginning of the next season. And they felt concerned about the number of people. That is quite rational. And the healthcare system up there does not have the resources that many other systems do if indeed people got injured for any reasons, not just coming into contact with others related to this virus. we started to reach out to other counties that expressed similar concern, and we realized that we need to process a protocol working with our county health directors and Fish and Game to then work on a county-by-county basis to address that anxiety. And that's what we have proposed to do. We had a little bit of problem yesterday, technical problems, because so many people called into the Fish and Game Commission that the system was overwhelmed, and we delayed an official decision on this. But let me just make this point clear to all the people that love the outdoors and love trout fishing or fishing more broadly in the state of California. We hear you. We deeply care about addressing your anxiety, and just know we are not ending the season. We just want to delay it a little bit and work with the counties to address the surge of interest and the need to keep everybody protected and everybody safe in this circumstance. Forgive me, it may have been a deviation talking about fishing at a time of a health crisis, but it's important as all of us are trying to find some semblance of normalcy at a time of deep, deep anxiety. I just want to express again to those that have that kind of anxiety that you're not alone. You may be staying at home, but you're not alone, that we have resources and we have support. If you have a teen who's in crisis and you're concerned about a loved one, we have resources and we have the capacity to help. If you are in an abusive relationship, you are not alone. Reach out to us, covid19.ca.gov, covid19.ca.gov. There is a treasure trove of resources there, hotlines you can call. If you're being abused or know someone is being abused, if a child is being abused, if your loved one is having a particularly difficult time, go to that site, get the support that you need. No one should be ashamed for asking for help. Nobody. The strongest people I know are the ones that have the courage to reach out and ask for help. Please do so. I recognize how difficult this is for all of you, particularly our parents, and how disproportionately this is impacting women. And I just want to again thank all the mothers out there that have to do so much on the natural and now have to double down yet again and again to manage the household, manage the kids disproportionately. And I just want to thank you from the bottom of my heart. I was raised by a single mom, and I know the struggles she had. I can't imagine, particularly for single mothers, what you're going up against. And just know we want to be there for you and do what we can to help support you. So that's an update, and we're here, of course, to answer any questions you may have.
Laurel Rosenhall, Cal Matters.
Hi, Governor. Thank you so much. Last week you mentioned the rollout of the Chromebooks and the hotspots, but we are hearing still from school officials who expect that some number of their students are just not going to be connected for the rest of the year. Maybe they don't have the right technology, or they just might not have a household where they can concentrate on learning. So what is the state going to do for these many children who are going to be so far behind? Is there going to be a mandatory summer school? Will families get an option to have their child repeat a grade next year? What's going to happen?
All that's being worked on in real time. As you know, CDE, Tony Thurmond, Linda Darling Hammond, the president of our state school board, have been having webinars about distance learning, focusing on special education as a particular topic of prioritization. As you also know, we were able to get 100,000 spots to get people connected throughout the state of California because of the generosity of Google, also thousands and thousands of Chromebooks. But let me extend to your question the obvious, and that's not enough. And there are gaps still. The superintendent, quite literally, for the last 2 days has been lighting up my phone and our team saying we need more help, and we need to go out together to procure more resources, more assets to help people with their distance learning, in addition to finding more Wi-Fi hotspots to avail the concerns that still remain about parts of the state that are still struggling with broadband access. And so those two things are happening in real time, again, at a scale that is larger than any other state in our nation. I want to applaud the superintendent for his focus on this. He as well just put in a specific budget request to me and my office as it relates to procuring assets that go to the second part of your question about what we do for those that are in this void, in this gap, and how we make up for time lost. And that includes conversations, yes, we are having around summer support and preparing kids for the fall school year. Just know that we are deeply focused on that, and over the coming days and weeks, we should have a lot more to say on this subject.
Brody Levesque, LA Blade.
Governor, my colleagues at NBC News reported that the pandemic is a perfect storm for LGBTQ homeless youth. So my question is going to be kind of a two-part, sir. LGBTQ youth and young adults make up a disproportionate number of homeless young people, and this is particularly true here in California. And they're facing diminished office hours at the LGBTQ community centers. They don't have unsupported family members, and of course, a lot of them obviously are living on the streets. Conversely, with LGBTQI students that are still enrolled in California's school systems, has your office or Superintendent Thurman's office looked specifically at the issues for these kids? Because in many cases, Governor, a GSA in a school, a supportive counselor, an affirming teacher, or interaction with other LGBTQI students is a critical and much needed concern for these kids. So I'm going to throw the two parts at you, sir.
Yeah. Well, this is a deeply personal issue for me that cares deeply about the LGBTQ community. And let me extend this a little bit more personally still. I just learned a few hours ago that one of my heroes, Phyllis Lyon, 95 years young, passed away. Phyllis, as you may know, I had the privilege of being involved in a marriage ceremony between Phyllis Lyon and Del Martin. The couple had been together almost half a century. The manifestation of faith, love, and devotion. And yet they were denied on the basis of their sexual orientation the right to say two extraordinary words, I do. The power and potency of those two words is profoundly significant, as is the frame of your question. We are struggling, as you know, as a nation to address the needs of our LGBTQ youth in particular. The state of California bears a unique responsibility to do more and better than any other part of the nation to address those needs. And we've done so through policy, through advocacy, and through highlighting those challenges. LA County in particular has been a leader. And as you referenced and as you know well, the number of LGBTQ youth, homeless youth, disproportionately is represented in LA County. And so we look at the world not through the lens of one size fits all, but through the competency lens and the unique needs, the unique challenges that reside within the LGBT community, and not just within the community writ large, but specifically on the basis of age as well. And so know that is a big part of our agenda, a big part of our focus, a big part of the reason we've been so aggressive in terms of these helplines, these teen crisis lines. They include specific resources on that covid19.ca.gov website, specific resources and hotlines for the LGBT community. And so I encourage you and others to direct people to that site and the resources we've made available specifically to the community on this site, and know that we're going to do everything in our power to continue to support incredible organizations, nonprofit associations, community centers as we recover from this crisis, because they disproportionately will be bearing the brunt of those that are particularly in need for a multitude of reasons and issues.
Alexi Kosef, SF Chronicle.
Hi, Governor. Earlier this week, Santa Clara County published its model for coronavirus infections online. Will the state make its model public at all so that people can understand why your projections differ so much from other models that have infections and resource use peaking in the next few weeks rather than late next month?
Yeah, we've done that, as you know, on multiple occasions. We'll continue to make them public. And so the answer is absolutely. We will continue to make presentations, continue to make available that information. As you know, we continue to iterate based on the data and what comes in and what's happening in counties, not just Santa Clara, but we're monitoring what's happening in all 58 counties throughout the state of California. Some counties impacted more than others. But one thing is certain, our models have improved. And that's because individuals have met the moment. Individuals are practicing physical distancing. Individuals are doing the right thing in terms of the stay-at-home order. And that has allowed us to not only bend the curve, it's allowed us to update our models as we do on a daily basis, but it has extended the period of time to which we have to prepare and to organize ourselves for a peak that, yes, is different from the one advertised by academics in other states within the state of California, a peak that we believe extends into May, not in the next week or two.
Phil Willen, LA Times.
Hi, Governor. Thank you so much for the update on the ventilators. I did have a question about that, though. I mean, how can you assure counties throughout the state that when they need ventilators, the state will be able to provide them? And if supplies become scarce, especially when there's a surge, what's the state protocol over who receives them first? Secondly, blood tests for COVID-19 antibodies are becoming more popular and getting more attention. How would you use those results from the test to inform your decision-making? And do you have any concerns that data gathered by that, possibly about lower mortality rates or widespread immunity, could generate complacency? Thank you.
Well, Phil, this is a great opportunity. I have my doctor standing right beside me who could talk more about the antibody tests. Dr. Galley, well familiar to folks in Southern California since he was running the system down there before now running our state system. He could talk more about the antibody tests. We continue to see progress in terms of not just more tests being conducted, but we have substantially reduced that backlog. Today, the number came in, it was 13,900. That's the current backlog. It's still too high. But remember, we were as high as 59,500. I believe that was our peak number in terms of that backlog. So we are seeing quicker results, still not as quick as we want to see them. And as you rightly attest on the basis of your question, we're not just doing traditional PCR tests. These are the swab tests, but now doing these serum tests, these antibody tests, these blood-based tests, which will be critical in terms of our capacity to make determinations about community spread and about immunity. But again, I am not a doctor, and I have one, and he will talk more about that.
Thank you, Governor, and thank you for the question. We continue to be very encouraged about serologic testing for the state of California. We have some of the best laboratorians, labs, academicians, and scientists around serology testing here in California. We are tapping them every single day to understand where the science is heading. We want to use these tests responsibly. You can use them in a number of different ways to get an understanding of community prevalence. Some suggest it might even be a trigger to immunity and understanding who is immune from the disease and maybe reinfection. We know that around the globe, the use of serologic testing is being discussed. There are countries that have gone out ahead and made decisions on how to use them, and today they are rethinking how they're used. So we in California are looking at serologic testing with a great deal of hope and anticipation, but also being very methodical on how we use these to guide our decisions. We continue to build up capacity on our ability to do the PCR tests, getting those not just into hospitals, not just into clinics, but more and more into the communities to prioritize testing healthcare workers, people on the front lines, and making sure that we expand that thoughtfully to touch communities that haven't been tested as much as they should, communities of color, communities of lower income, ensuring that California keeps that equity lens at front and center with all of our testing and all of our work. So as we remain hopeful around serologic testing, and we build up our understanding in science, not just the availability of those tests, we continue to work on our PCR capability and really expanding, as the governor put together the testing task force, not just our understanding of how testing is going in the state, but also our strategy to make sure it targets the right people and then we get it broadly to as many Californians as who need them.
On the ventilators?
Oh, yes. On the ventilator question, thank you. We also continue to work, as the governor mentioned, have a strategy to make sure that our ventilators are pre-positioned, that we have a mutual aid system that allows those hospitals that need another ventilator to lean on each other in a regional system. We also reach out to our critical access hospitals where there may not be very many ventilators on hand, and where even a small surge would demand that they need more ventilators, checking in with them continuously, making sure that we prioritize their needs so that every hospital has enough to be able to serve the surge that we anticipate. We also know, as the governor said, that there's an ability to call back ventilators that we've loaned to others to save Americans to make sure that they're available here. We continue to refurbish many ventilators from across the state so that those are working and available to patients when they need them. So it's an ongoing work between CalEMSA and OES and our local partners to ensure that they have what they need so that patients who need them at that time have them available.
Appreciate that, Doctor. And look, no one's naive. We're all searching for more ventilators. As you know, Phil, our goal is to find 10,000 additional ventilators. We've been working with companies to procure and supply chains to secure new ventilators directly from around the world. We've had some success in that area. Some have been delayed, but we're also not waiting around. And I'll just remind you and others of the work that Virgin Orbit is doing. They're repurposing their lines down in Southern California. They brought up a prototype last week right here at the Cal OES at the State Operations Center. These ventilators were incredibly impressive. They're bridge ventilators. They're not built to last forever, but they're built to address the acute needs within our healthcare delivery system. These things are now being produced, and it will provide us a capacity, in addition to what the doctor just said, not only to prioritize traditional ventilators, but also to create step-down ventilators, these bridge ventilators, and make them available to people that are not in a same state of acuity as others may be. So again, it's all part and parcel of a broader strategy. We continue to be blown away by the work that Bloom Energy and others are doing, refurbishing ventilators as they come in. We're sending them out to get fixed, and then we're getting them out into the system. But again, over 8,000 are currently available as I speak within the healthcare delivery system, but each part of the system has different needs. And I think the most important thing you just heard from Dr. Galley was some of these rural systems, some of the smaller hospitals, quite literally 1 or 2 ventilators is an order of magnitude versus the other larger hospital systems where that may be insignificant. It is precisely those hospitals, the smaller ones, that we're really hyper-focused on as a top priority in terms of answering your question.
Kathleen Renane, AP.
Hi, Governor. I have 2 different questions for you. One is about the distribution of the new masks that we're going to be procuring. You said that these masks would go to healthcare workers, grocery workers, some others. I talked to the California Retailers Association yesterday, and they said that at this point, the state has not been providing grocery chains that they represent, like Safeway and Raley's, with PPE. So if you could just be clear on, what are the pool of industries that we're expecting to distribute those new masks to? And then second question, on the hotels for healthcare workers, what's the estimated cost to the state, and how does this affect the availability of hotel rooms for homeless individuals?
It doesn't compete with Project Room Key at all. By the way, Project Room Key now is 8,742 rooms that we have been able to get operating agreements on. Thousands now people are moving in, getting close to 2,000 individuals that were on the streets or in shelters now into those hotel rooms, hundreds every single day, moving in real time. So it doesn't compete with those resources. These happen to be some of the larger hotel chains that are participating in this program. And the program is paid for, let me be specific, again, by the incredible support of FEMA. We built this in partnership with FEMA and the state of California. Not dissimilar to Project Room Key, FEMA has prioritized, to their credit, the federal government, to get people out of congregate facilities, congregate settings that may have been exposed to COVID-19 or have contracted the virus. Those are the priorities for reimbursement through FEMA to isolate these individuals in hotel rooms and quarantine individuals in hotel rooms. We also, as you know, because we announced this a few days back, have received $25 million from Mark Zuckerberg to help with stipends. And these are the folks that are part of our health corps. And by the way, 350 people are getting letters literally today to begin to be introduced into our workforce from the health corps database. So 350 people have been interviewed, vetted. We've identified spots for them. They will be prioritized at our FMS sites throughout the state of California. The acceptance letters going out today. They will be state employees, part-time state employees on the basis of the need to address this crisis, and deployed at those federal medical stations that were also sent to us with support of the federal government. So that's the framework for the how we pay does not compete with our homeless program. As it relates to prioritization, it always remains in this order. We were clear about this yesterday. We were clear about this last week. We were clear about it a month ago, and I'll continue to reinforce, and I appreciate the opportunity to do so again today. We will prioritize our frontline employees in the hospital system, in our nursing homes, those that are on the front lines. That includes broadly those that are in community clinics, not just those acute facilities. So hospital, healthcare workers, top priority. First responders, broadly defined. The second prioritization in terms of the PPE. I am well aware of the needs of the grocers, as you appropriately and correctly identify. Their union in particular has made it crystal clear that they're not getting the kind of support, even within their companies, let alone by the state and the federal government, that they believe they deserve, and I believe that they deserve. So we are opening up as these new supplies come in to broaden our prioritization to be inclusive of our grocery workers. And I also made this point, and I'll repeat it, I want to see if we can extend that into our logistics operations. A lot of our folks in warehouses, a lot of our folks that are transporting goods and food and commodities also have requested support, and we want to provide for as many people we can. Never forget our IHSS workers as well. So look, if these numbers come in as we are hoping they will, as contractually they're obliged to come in over the course of the next few weeks, you'll be hearing about substantial increases in personal protective gear that will be distributed across the panoply within the system.
Final question, Vicky Gonzalez, KCRA.
Governor, is the state considering emergency funding to help property owners receiving reduced or going without rent, as well as financial help to renters who will need to make up that back rent?
All of that's part and parcel of ongoing conversations with legislative leaders. I just want to make this personal point. I cannot thank Tony Atkins enough, Senate Pro Tem, Speaker Anthony Rendon. We had our regularly scheduled calls again this morning. We communicate on a consistent basis. They have been extraordinary leaders at a time of crisis. Their members have been extraordinary and have been incredibly supportive of the broader state efforts that transcends political parties. I would extend that to Marie Waldron as well as Senator Shannon Grove. I want to also extend that to our federal partners, Republicans and Democrats, both in our House of Representatives as well as the U.S. Senate. Kamala Harris checking in consistently, Dianne Feinstein, and the incredible leadership of Speaker Nancy Pelosi. We are working very closely with her, specifically to answer your question in this respect on the next federal stimulus. And that stimulus will address a myriad of issues, including the anxieties of renters, property owners, small business owners, and across the spectrum, hospitals, caregivers, to help us through this crisis. We're going to need all the support we possibly can get. And as you know, we're in the process of reviewing what we refer to in Sacramento speak as our May revise, which is taking my January budget that I submitted for consideration to the legislature for their concurrence and approval. We'll be updating that consideration based upon all of the incoming that we're receiving, including relationship to the question you've asked, the questions that were asked yesterday and the day before that about this group or this concern or that concern. And we will all put this together, and hopefully through this process, the collective wisdom will come forth with a document that will be sober, but hopefully will advance the cause of doing our best for as many people as we can, always with an eye on the most vulnerable. And let me end on that. I wanted to update all of you on the numbers that are coming in, again in real time, on the disaggregation of data that we've received on the total number of positive cases in the state of California, the total number of deaths in the state of California, from a lens that is more appropriate, and that is issues, how it's impacting the virus, the African American community, the Black community, how it's impacting the Asian community and the Latino community. The new numbers are in. 54% of the numbers now have reported up to the state of California. Again, we were at 37.2% yesterday. We're at 53.54. And why do I say 53.54? Because that's the total number of positives versus total number of deaths. We're going to get to 100% soon. Bear with me, but full transparency. I committed you that. Here are the current numbers. 30% of the positives impacted the Latino community, 25% of the deaths. 7% of the positives impacted the Black community, 8% of the deaths. And 13% of the positives are now identified within the Asian community, 18% of the deaths. We will put out additional numbers on Native Americans, on Caucasians. All of that will be available on our website for individuals to review. But those numbers are not inconsistent with the first tranche we put out yesterday, but 54% of the data is not 100%. And so we'll continue to provide those in real time and do our best to keep everybody informed, and not only just inform people of that data, but to inform you on what we're doing with that data to actualize strategies and plans to address those disparities as we must as a state and obviously as a nation. Let me again thank everybody for all of your extraordinary work in continuing to practice physical distancing, continuing to consider the benefits of wearing face coveralls as it relates, or face masks of some sort when you go out and you cannot practice physical distancing, particularly in our grocery stores and the like. Continue to be inspired by the leadership of mayors from London Breed to Sam Liccardo to Darrell Steinberg and what he just did. We're getting 1,000 folks that he's committed to getting off the streets and sidewalks of Sacramento County, to Eric Garcetti. Incredible work that's being done in the Central Valley. Republicans, not just Democrats, in communities large and small across this state. Down in Long Beach, Mayor Garcia. I just want to thank them all for their incredible work. For all the county health directors that are putting out the prescriptive guidelines and directives every day, thank you. You have the toughest job of all of us, making decisions in real time about what's best for your local community. Thank you for continuing to have a collaborative spirit with all of us here in the state of California. And I want to thank the other governors in states large and small. The conversations every day are growing in number and in impact. I know what they're up against. We all are dealing with our own set of challenges, but none more than Governor Cuomo and Governor Murphy and others in New York and in New Jersey. And I just want to thank them for their hard work, thank them for their incredible generosity in terms of the work they're doing to see what they can do to help support our efforts here in California. And I continue to be inspired by their leadership, as well as the great work that's being done nationally by our task force, FEMA, and the White House and their support. So forgive me for being long-winded, but gratitude is deserving at this moment, and extending it is important, as it is to each and every one of you that continue to do everything in your power to continue to bend this curve. Please volunteer. Please do more for food banks. Please contribute blood, time, and please continue to stay safe, stay healthy, and check in on others.
Quick 15-minute type testing that we're starting to see come online now, so that we can do more contact tracing and isolation of those with respect to those individuals.
So, look, we're all concerned to make sure that we bring this economy back to where it could be, should be, after we're able to get past the peak and past the danger that this poses for many people. But that is very, frankly, it's unrelated to the rise in the minimum wage, which is a very small raise. You know, each year it goes up by a little bit, and it's a very small raise that's coming in July relative to you know, the entire raise, which happened over will happen over a 6-year period.
Okay. And Governor, the rules of unemployment were supposed to change to allow them to apply for benefits, but we're hearing from many people that IDES has not yet allowed them access to apply. Is there a time frame on when this will happen? Any advice for these people?
Well, there are federal benefits, you're right, that were provided in the federal bill. But almost no state has this available to them, because you've got to build a system for that. That's not just something you can add on to your existing system. So we've hired the necessary personnel. We've hired the outside provider who can build the system for us, and it'll be up in the coming weeks.
Okay, so coming weeks, kind of the timeline for that.
Yep. Okay. And again, we've got, we've hired the best. We can, they're working as expeditiously as they can. Every state has this challenge, so, we're going to, do it as fast as we possibly can.
Okay. And last question for me, unless more come in. Across the state line, there's a community that's changed their 4th of July plans. What should we expect for the summer, and could we go through this again come fall or winter?
Yes. In short, yes. The fact of the matter is that we are not going to be truly able to begin to move on until we have testing, much greater testing, contact tracing, and treatment. Test, trace, and treat. We have to have those available. That's even before there's a vaccine, but you have to have all of those. You have to have testing widely available. You have to be able to easily contact trace for anybody that tests positive, so we know all the people they've talked to, been in contact with in the last 14, perhaps 17 days. And then, of course, there needs to be some treatment to bring down the level of hospitalization, the level of ICU beds that are necessary, and, of course, the number of deaths.
Governor, your counterpart in New York said this morning that they're working to ramp up testing sites in the African American community. You are well aware of Chicago's situation. What is being done here in Chicago to get more testing in the African American community?
We're doing that very same thing. In fact, I was just talking this morning and yesterday morning about a drive-through site that we intend to put up in the south suburbs in a heavily African American community. We're looking at other sites, and the placement of testing sites is directly related to who's getting tested, of course. So we wanted to make sure that we spread those 5-minute tests, or the 5 to 15-minute tests, the rapid tests, into communities where we know we have significant issues, like the African American community. So those 15 machines that you heard me talk about yesterday that we're trying to get more testing capability through, we want to make sure that when those tests come in, that many of those are placed in communities where, particularly African American communities, where we have more vulnerability than others.
We were hearing from the mayor also this morning about the money the city, the CTA, CPS is expecting to get from the federal stimulus bill. Have you got an estimate as to how much Illinois is going to be getting on that? If you already talked about that, forgive me. But
you mean just on schools or overall?
No, just overall.
Overall, yes. So but by virtue of the last bill that was passed, and remember there's a series of bills. There was a third bill, the third relief bill. It was named the CARES Act, but it was actually the third in a series. That bill had about $2.9 billion of reimbursement for COVID-related expenses to support the states. The state of Illinois, $2.9 billion just for the state of Illinois. Actually, let me revise that. It's about $2.7 billion. Apologize. And then there's about $2.1 billion that's going to cities across the state as well for various purposes. So we do know what the amounts are. The rules around it are still in flux. There's some discussion by the Treasury Secretary Mnuchin about adjustment of the rules, because states operate differently one to another, how they manage all of their affairs, and it isn't maybe written quite the right way in the bill, but it allows the Treasury Department to make adjustments to how you get reimbursed. So I'm optimistic anyway that we'll be able to get the full $2.7 billion of reimbursement.
Governor, as you know, many undocumented residents living here in the state of Illinois, mostly Latino, working families, suffering this crisis as everybody else, without help from the federal government. What's your message to this population, and what kind of help they can get from the state during this crisis?
So you're speaking specifically of undocumented immigrants in the state of Illinois. A number of ways we're providing support. One of the major ways is through the COVID-19 Relief Fund, which is ilcovidresponsefund.org. And people can apply for direct relief there, or through organizations that are recipients of those funds. So that's one way. There are numerous programs in the state of Illinois that are not related to federal relief, that therefore allow us to support any resident of the state of Illinois, whether they're a U.S. citizen or not.
Okay, we'll go to some questions from reporters online. A lawmaker on Twitter said they would like me to say who the question is coming from, so I'm going to try and do that. This is from Lisa Donovan at the Chicago Tribune. With Dr. Ezike saying the rate of COVID-19 cases seeming to be slowing, and one of the more trusted COVID-19 forecasting models showing Illinois could peak come Sunday, and that the number of deaths are about half of what's been predicted, I have two questions. Is the governor concerned that the public may throw caution to the wind and ignore the stay-at-home order? And or does this latest data suggest that the stay-at-home order may be lifted before April 30th?
I am worried about people throwing caution to the wind and seeing a nice day outside and thinking that they're not in danger. You heard Dr. Ezike talking about how some young people think that they're invincible, that this virus won't affect them. So everybody needs to know that if we are improving, and it's still up in the air, but if we are improving here in the state, it is because people are staying at home. That is something to keep in mind. So if you don't stay home, if you go out, you have, some propensity to infect other people. And we need you to stay at home. We need this curve to bend, and then we can begin to talk about how we can begin to open things up a little bit more. On the second point, which was, the question about whether we're...
Do you think it'll be lifted before April 30th?
Yeah. Look, we talk a lot about peaking, and we talk a lot about how we're bending the curve. The curve is still upward trajectory. And so just because we're bending the curve does not mean it's bending down yet. And so people need to understand that it is unlikely that we will be able to lift this stay at home before April 30th. And indeed, as we approach April 30th, we will be thinking about what are the restrictions or rules that we need to set going forward after April 30th, because it isn't going to be, unlike what some have said, at the federal level, it isn't going to be that all of a sudden you're going to drop the, stay at home and every other restriction. And that's because there is a propensity, as another questioner had, that if you do that, we're going to see a big spike upward, and once again, hospitalizations, ICU beds filled, vents filled, and more death.
This is from Marianne Ahern at NBC Chicago. Can you confirm the report that 3 Lake County hospitals have reached ICU capacity peak, and does that mean McCormick Place will accept patients sooner than next week?
Thank you for that question. So we divide the 211 hospitals that are in Illinois into regions. Lake, I believe, is Region 10. And in Region 10, there are 10 different hospitals. And so when we follow this, again, that's one of the roles of public health, is actually to follow bed availability, ICU capacity, vent capacity. So as we look at those stats every single day, we know that that region has some hospitals that are that are filling up, but we know that there are other hospitals in the region that still have available beds. And then just a few miles further, there's other hospitals in Region 8 that have available beds. So we're keeping an eye on that. Again, we are not seeing an indication to open McCormick yet, but we are following closely the capacity in all of the regions, and we are recommending the continued collaboration of hospitals with their hospitals in their region to increase, to ensure that that communication is there, so that they know that, oh, my hospital may be full today, and know that the other hospitals around still have some capacity.
This question is from John O'Connor at the AP. Did anyone at the federal level alert you to stockpile depletion? Surprised? Unfilled orders from it? Partnering with other states, consortiums to get PPE now? How much has the state spent on PPE?
We've been hard at work, as all of you know, across the globe, trying to find PPE, place orders for PPE, and then, importantly, having it shipped and delivered to Illinois. That last part you might not think is a major obstacle, but it is. And it's partly because it's very difficult right now to get things out of China, which is where much of the PPE comes from. But we continue every day, and we've actually had some recent successes at getting things loaded onto cargo aircraft and delivered back to the United States. So there is progress in that regard. And we believe that we're going to continue to meet the PPE needs of all of our hospitals. We think that we're going to continue. Remember, every hospital has its own store of PPE, and then their health department in the local area, wherever that hospital is, has a store of PPE, and then the state has a store of PPE, and the city of Chicago has its own large store of PPE. So there are multiple levels of support here. And in terms of what's been spent on PPE, we're going to be listing the various contracts online so people can take a look at it. I couldn't tell you what the total is now, but I know that it's not infrequent that we have to place a $5 million order or even a $10 million order for PPE. Think about the cost of what is normally an 85-cent or $1 N95 mask is now going for anywhere between $4 and $7 a piece. So if you need millions of them, as we have indicated that we do, a million of those at $5 a piece is $5 million. So, and that's just N95 masks.
This is from Ed Zadi at the Sun-Times. Governor Baker of Massachusetts has launched a virtual call center of 1,000 people to trace contacts of those testing positive for COVID-19, thus helping stop the spread of the virus. Are you considering any similar contact tracing measures in Illinois?
Yeah, because it's a great, what they did in Massachusetts is a great indicator of what really needs to happen all across the nation, and especially as we, I talked about as we, peak and move beyond the peak. I talked about testing, contact tracing, and treatment, and that tracing piece is a huge one. So what we've been doing up to now is tracing individuals as they have been identified, but as we increase the testing across the state, and we are increasing, because the last time we talked to you about contact tracing, I think we were doing about 1,000 tests per day, and now we're doing about 6,000 tests per day. There's even more need for contact tracing. So I would just say we are working on that. I liked what Governor Baker did with regard to creating a core of people who do that, and I think that's something that we will consider doing here.
This is from Hannah Meisel at the Daily Line. What is DHS's plan to mitigate the spread of COVID-19 in residential centers for the developmentally disabled now that cases are reported, especially given the challenges that population presents, including not necessarily understanding what's going on?
Yeah, I'm going to allow Dr. Ezike to answer the latter three-quarters of this, but I just want to say that congregate settings, we've talked about this a lot, are very, very difficult ones. But they're necessary. Congregate settings are necessary. They're difficult ones for us to manage. However, provided PPE to the staff, for residents who need it, and have specific set of protocols around it whenever there is. But, well, first of all, right up front, we closed down visitation at many of these facilities, most of them, in fact, because we didn't want any outside people coming in, bringing COVID-19 in with them. But a lot has been put in place, indeed, even at the ones where there are COVID positive test results now. So we believe that, we're going to be able to limit the spread as best we can with PPE, with staff following the protocols, and by separating the various residents between those who have COVID-19 and those who haven't. But Dr. Ezike?
As being part of the Health and Human Services portfolio, we're close partners with IDPH, and at the end of, again, time is becoming relative now, but I believe at the end of February, beginning of March, they were very proactive. They were immediately following recommendations to start thinking about their facilities, trying to identify their space issues, trying to figure out how people would be able to be spread out if they needed to isolate and segregate. They, as Governor said, were right on top of it in terms of closing down facilities to visitors. I know sometimes people would think that sounds difficult, but in a situation such as this, where you know that the virus is being brought in by a visitor, that is the aggressive step that has to be taken. Also doing pre-shift assessments on people who work in the facility. So they were even proactively looking at, instead of moving people back and forth, they were bringing providers that had to assess people in terms of trying to figure out if there would be need for evaluation, if it could be done on site instead of transferring to a hospital. So again, a lot of steps were taken even before they had a single case. They do have some cases in some of their facilities now. IDPH is working close with them in terms of having a consultant and infection control preventionist working directly with the facilities. And so we're keeping a close eye, and partly I think we had a delivery of PPE with thousands of masks, surgical masks, and N95s that even should have been delivered today. So we are following closely, and they're doing a great job, and we're going to mitigate as much as we can.
This question is from Jamie Monks at the Tribune. There have been reports that HHS plans to no longer support community-based COVID-19 sites, many at Walmart parking lots. Is this accurate? Has the state been told this? Will these test sites continue? If so, who will pay for the testing?
Yeah. So just to back up a second, HHS, the federal government, set up this organized effort to have drive-through facilities with Walgreens parking lots, Walmart parking lots, and signed a deal with LabCorp and Quest, which are two of the largest laboratories in the nation, to do the actual evaluation of the test. The swabs themselves would be done at the drive-through, and then those swabs sent to LabCorp and Quest. That's what we're talking about when we talk about the federal sites that HHS put up. We have a number of those sites in Illinois. It is true that on April 10th, which I think is tomorrow, they will be handing over those sites to the states. Their intention, they didn't say this up front, but it became clear about a week ago that their intention was to set these up, to make them operational, and then to hand them over to the states. And so we are taking over those. We will be providing personnel. We've asked for as much support as we can get from the federal government in that turnover, because obviously we have a limited number of healthcare personnel available in the state, but we need to do this testing. I think the biggest challenge is that they're only providing a limited number of swabs for each of those sites, as they have only been using a limited number of swabs themselves at each of those sites, and we'd like to do more. And so I've asked for more swabs from the federal government. We'll see whether we're able to get them, but our intention is to do as much testing as we possibly can in those drive-through sites. But I just want to make it clear that taking a swab is not doing a test. Taking a swab is taking a specimen and then putting it in a vial and then shipping that vial somewhere where the test is done. In our case, we're building up our testing capacity in the state of Illinois. Right now we do we do thousands in the state. What the federal government was doing is sending it off to these other laboratories around the country. It takes 7 to 10 days to get a result. I've even heard of longer from those. So we don't want to have to do that. And so that's why we've bought machines. That's why we're working so hard to build up our stores of VTM, the viral transport media, of swabs, and of RNA extractor, so that the reagent that's necessary, so that we can do more of that here, so that we can get faster results in those drive-through facilities. But we're grateful to the federal government for setting them up. But in the turnover, it's going to be difficult because we're not getting provided as many swabs as we would like to.
This question is from Shia at Politico. Can you tell us, Governor, what are a few specific lessons or takeaways you learned from New York or other places in how to handle the coronavirus?
Well, as I watch the challenges in New York, I mean, one is preparation. I don't know if you noticed that we actually put our stay-at-home order in at, I think, exactly the same day, a little bit, maybe a few hours before New York did. But on the same day, March 21st is when ours went into effect. We announced it on the 20th. But New York had more cases earlier than we had. And so they were further along in the curve, I guess, I would say. And so when they got around to figuring out, that they would need much more hospitalization capacity, they began to build out and plan for and build out Javits Center. I think we were a little bit ahead of them just in the timing of planning for the build out of the McCormick Place alternative site. And as you know, we have many more sites that we're spinning up in the event that we have a need for them. So I just overall, I would say, being early at it is certainly something that's been very important to us. I think the other thing I would say is I've talked to the governor of Washington a number of times to talk about what they did and didn't do right around nursing homes, because we all remember that they had a terrible problem with one particular nursing home, and we wanted to make sure that we knew what went wrong there and what we should do right, and they learned their own lessons that they shared with me. And that's the last thing I would tell you. I call governors, I mean, virtually every day, certainly on average, I talk to one a day around the country to hear what they're doing today, how it is that they've accomplished something that we may need to accomplish, or to share what we've done with them. And that's been vitally important to the success that we so far have had, any success that we've had so far. And I'm trying to learn lessons as we go.
This is from Jim Leach at WMAY. What advice would you give to organizers of big summer events, concerts, etc.? Should they plan to proceed, plan on crowd limits? Should they think about canceling?
I think everybody needs to think seriously about canceling large summer events. From my perspective today, I do not see how we are going to have large gatherings of people, again, until we have a vaccine, which is months and months away. I would not risk having large groups of people getting together anywhere. And I think that's hard for everybody to hear, but that's just a fact. They're just, even with, testing and tracing and treating, as is necessary for us to begin to make changes, it isn't enough for me to say that it's okay to have a big festival with a whole bunch of people gathering together.
And this will be our last question. It's from Mike Flannery at Fox. Have you heard of the WorkShare program helping 29 states and Washington, D.C.? A University of Illinois professor says Illinois could get $1.1 billion and avert up to 124,000 layoffs. Will Illinois join it?
Yeah, it's an excellent program. I understand that the availability of that program was open under the previous governor, and he didn't act upon it. We are looking at how we might open a program like that, a WorkShare program, and I don't disagree that whatever we can get to support workers, to expand the workforce, or make available opportunities for people who are laid off, we're going to pursue.
All right, thanks everyone.
Let's see, what's today? Thursday. Yeah, it'll be early next week. Yeah, thank you. But again, may not have any patience. Yeah, I hope.
difficult thing to navigate through, but that's been the approach, and that'll be the approach this time. So we'll certainly announce before the date comes, but no plans about specifics yet.
Thank you.
Mm-hmm.
Next, we'll go to Hannah Wall-Smith with WMC. Hannah, your line is open.
Hey, Governor. It was mentioned yesterday that American Family Clinics are offering the 5-minute rapid COVID testing, and it appears that there's only one of those clinics in the entire West Tennessee versus several in Middle and East Tennessee. Since Shelby County, Tennessee has the most cases of COVID in the state, is there any priority here in this side of the state?
Well, we want to make sure that every community has access to testing. We have made very strong efforts in every community, including Shelby County. Significantly, your private providers there as well are providing significant testing opportunities. We are trying to get into every neighborhood and are in neighborhoods. We're utilizing nonprofits in neighborhoods to reach out to encourage people to get tested. That particular company and that Abbott Lab machine and testing capacity they have, that's a private company. Their facilities are, their facilities are limited to where they have those private facilities. But we know that there's going to be more of that Abbott testing coming online in the next few weeks that'll provide for point of care testing in a lot of places across our state. But we're committed. We're committed to testing. We're committed to testing in every part of the state, and we have we've ramped up that and made widespread testing available. And let me say this: we're not aware right now of any testing facility that is turning away people who request a test. Now, these of course are people who qualify for a test and who have been referred to a test or are presenting with the appropriate symptoms, but we're not turning away people for tests right now. And if we find a place that is, or if there is someone out there who, if there are folks out there that are being turned away, we want to be made aware of it, because we're trying to get ourselves in a position where folks are not turned away, and in fact, developing strategies to ramp up testing significantly all across the state. So we have a strong commitment to it.
Thank you. And can you specify any locations of the 35 care sites that you announced Monday? Are those any of those in Shelby County or Memphis?
Health Department, if they're available to be seen on the Tennessee Health Department website. And there's a health department, there is testing at every health department in every county in the state. So as well as a number of other opportunities to have testing in Shelby County. So that information is available on the website.
Thank you.
Thank you.
Next, we'll go to Sam Stockard with the Daily Memphian. Sam, your line is open.
Yeah, thanks, Governor. Now, we've been asking some of the Memphis hospitals for information on the numbers of beds, ICU beds, and ventilators used by COVID patients specifically. And they say they have that information, but that the state has told them not to release the numbers. Is the state telling them not to release that? And if so, why? Because wouldn't it help local officials make better decisions?
Yeah. Dr. Pierce, you want to answer that?
Sure. On hospital level reporting, we have not given any mandate to not share that information per facility. If facilities want to share that, they're welcome to do so. Their general, what we call sunny day capacity, is widely available. That's publicly reportable. We report information on an aggregate basis statewide, but if facilities want to share that themselves, there are no restrictions from us to do so.
But has there been any encouragement for them to do that?
It's always been up to them. We have neither encouraged nor discouraged, but if they find that a useful data point to share, they are encouraged to do so.
Okay, thank you.
Next, we'll go to Jason Lamb with News Channel 5. Jason, your line is open.
Thank you, Governor. Staying on the line of questioning just about testing, the Trump administration has said it's pulling back federal support for the FEMA-administered community-based testing sites. I was wondering what impact that's going to have here in Tennessee and testing that's going on here.
You know what, Patrick, I'll let you make a comment on that. Patrick, our TEMA director who works with FEMA, but we don't believe there's going to be any impact, particularly in light of the fact that we're expanding our testing efforts across the state. But you want to comment on that?
Yes, sir. So our testing in Tennessee has been done, local health departments, the Tennessee Department of Health and the National Guard, along with private providers. We have not had, in Tennessee, we've not called upon the federal government to assist us with our testing. We've used resources. We've asked for federal support with getting some testing supplies occasionally, but these have been Tennesseans and Tennessee companies supporting our testing efforts.
Great. And Governor, I also wanted to know, just with so many people out of work right now, so many unemployment claims being filed, we've seen the Jobs for TN site facing computer system failures. How accurate do you feel that Tennessee's reported unemployment rate is right now? Do you have a sense that it might actually be much higher than what the data shows because so many people are having problems getting their claims through?
Yeah, let me first just say we know what a challenge it's been for those who are trying to file for unemployment through the state. We are aware that that's created a great hardship for people. We're working really hard to overcome that, but we acknowledge and we know that that's been challenging. As you know, we're having 25 times more filings than we traditionally have. That's put an enormous strain. We have, significantly increased our resources, gone from 20 folks to I think 250, and we're working to upgrade that system. So we're working hard to change it, but we acknowledge and we know that that's been a real struggle for folks. We do think the data is appropriate and information is correct because we have, to the degree that someone actually files the claim, we know that we capture that data, but we certainly will continuously look at and make sure that our data is accurate. And the biggest goal for us is to make sure that Tennesseans can get those claims processed more quickly, and that we can actually get those payments out. We're merging the federal dollars with our Tennessee dollars, the unemployment from both of those programs into one. We're working hard to get it done. We hope to. We know we've had problems, but we're getting there.
Next, we'll go to Larry Stone with 94.1 in Cookeville. Larry, your line is open. Larry Stone, your line is open. Okay, we'll continue on. We'll go to Sergio Martinez Beltran with Nashville Public Radio. Sergio, your line is open.
Thank you, Gillum, and thank you, Governor. I do have a question. Governor, you've talked a lot about, the self-employed and how the state will be helping them through this process. But can you talk about specifics? What is the state going to do with people that are self-employed?
Well, what we talked about specifically yesterday was clarifying and making certain that those who file 1099s and who are self-employed, that they can apply for the same unemployment benefits that any other displaced worker can. There was some uncertainty about that, and that actually it required guidance from the federal government in order for us to opt into that program, but we have. That specifically is what we talked about yesterday. I think that answers your question.
But yesterday you talked about how the Department of Labor was changing some codes. I want to make sure I got that right.
Was what, Sergio?
Yesterday you mentioned that the Department of Labor was changing some codes to make sure that the self-employed qualified.
I know we just actually had to opt into the federal guidance and make sure that we followed the steps so that they could in fact apply and receive those same unemployment benefits, and they will be able to do so. And one of the things we said was if you are self-employed and you filed for unemployment, you're logged into that, so there's no need to go back and refile. you'll receive those benefits just like any other displaced worker will.
Thank you.
Next, we'll go to Andy Scher with the Times Free Press. Andy, your line is open.
All right, thank you. Commissioner Piercy, getting back to the testing, this Vanderbilt model was saying that social distancing is working. However, it says that if you all get this up too soon, there's going to be a surge, and hospitals are going to be hard pressed, and as many as 5,000 beds being filled. So I realize that you were saying that there are different models, but how much are you taking that into consideration?
That actually brings up a good point that I should have mentioned earlier, and I didn't. Every model, depending on, and no matter what you look at, there are assumptions made in those models. And I would encourage you, when you're looking at any of those, to look at that fine print and the assumptions that are made. Specifically as it pertains to the Vanderbilt model, we've been in communication with the experts there last night and today about the new data that they added for what is to happen in June if social distancing measures are reversed. It's our understanding, and this is subject to change based on further conversation, but it's our understanding that that model that projects a big surge in June is contingent upon complete reversal of the current social distancing practices. I don't believe anybody expects that to happen, but it's really hard. And I did reference earlier about modeling being based on previous action and historical data. So it's really hard to predict what somewhere in the middle would look like as we think about, and as everybody in the nation is thinking about, how do we incrementally bring these things back online? So it's sort of an all or none scenario, and so we expect, based on what social distancing efforts are maintained or are relaxed, it to be somewhere in the middle.
Well, I mean, that was, if I could follow up, that's exactly what they were saying, that it could be, it wouldn't be that bad. But again, that all hinges on you all continuing this order to the extent that you have, does it not?
So what we're looking at is where does that fall in the middle? It's not all, it's not none, and how we can ratchet up our efforts to open back up the economy while still maintaining a reasonable epidemiological curve. So your point's well taken. It's not going to be all or none, but we are looking at how we can do that incrementally.
Thank you.
That's all the time we have for questions today. Governor, if you would like to make a closing statement.
No, thank you all for being here. Thank you for all of you who joined and questions you answered. Remember that we are all in this together. You, every single person listening here, has a job to do out there, and that's to continue on the same path that we have. We are encouraged with the direction that things are moving. Albeit slow, but we're moving in the right direction, and it's because of the efforts that you have made. Continue to make those efforts, continue to work together, and we will get through this together. As we observe Good Friday tomorrow, we will not be having a briefing on tomorrow afternoon, but we'll be back on our regular briefings on Monday. Do your part and stay apart. Thank you. The Department of Labor and Workforce Development is currently reprogramming jobsfortn.gov to accommodate the federal program, Pandemic Unemployment Assistance, or PUA, as you've heard about, and the new $600 weekly federal benefit. The department is working diligently to make these changes as quickly as possible so Tennesseans can start receiving both the state and the federal payment. As we build surge capacity, which we are doing right now, one of our most important components isn't just finding the sites to build additional capacity, and it isn't just netting additional personal protective equipment and other critical supplies. We have to have qualified healthcare workers to staff our surge capacity in the event that COVID-19 overtakes the load on our hospital. The cases overload our hospitals. The Department of Health created an online sign-up for healthcare workers to register if they were willing to serve. And so far, over 800 healthcare personnel have engaged with us through that portal. As we encourage healthcare workers to join us in surge planning, our staff and our alternative care sites, we want to make sure these personnel have the skills that are needed to meet the demands, especially clinicians who are retired and considering rejoining our efforts in surge planning. Our group set up to attack COVID-19 through our work with Launch Tennessee has developed a public-private partnership with HealthStream. HealthStream is a publicly traded Tennessee-based company that provides education resources for 80% of the hospitals in this country. HealthStream has offered its learning platform, its COVID-19 training content, and HealthStream employee support free to the state of Tennessee to facilitate the launch of these alternative healthcare facilities and education for those who will man those for our surge planning. Although COVID-19 has created tremendous disruption to every one of our everyday lives, we're seeing new innovations launch every day that are going to help us defeat this virus. At the end of March, Abbott announced the development of a new rapid COVID-19 test on the ID Now machine. These rapid point-of-care tests show a positive COVID-19 result in as little as 5 minutes and a negative result in about 13 minutes. The development and implementation of this technology will help states all across the country to test more people faster and to chip away at the testing backlog that's been such a problem. Yesterday, the CDC provided our state health lab with one ID Now machine and 120 initial tests. And we're actively working to get more tests and to maximize this technology after we try this initial round. American Family Care operates clinics across Middle Tennessee and is deploying the use of this Abbott ID Now at their clinics, and they have the capacity to test close to 4,000 Tennesseans. The aggressive efforts of the private sector once again have helped to make our state a leader in testing for COVID-19.
you are passing it. But here's the challenge. We got to pass it every day. We have to pass it every hour of every day, knowing that just one decision that we know isn't right can truly affect and infect a lot of people that are out there. So we know we're going to get through this because we're going to follow the 10 steps that we talk about every day to defeat this coronavirus. Number one is the most important. Healthy at home. You should be at home. Yes, you can go to work if you're going to work. Yes, you can go to the grocery store if you need to go there, or the pharmacy. And yes, you can go out and get exercise, but none of those are supposed to be an excuse for socializing. They're supposed to be for getting what you need. Remember, when we all thank these healthcare providers on the front lines, and we should, that all they've asked for us is to stay home. Even when they appreciate the meals and the rest, the number one thing they're asking is to stay home. And I don't think that's a very big ask for what they are putting on the line. So let's make sure we honor their courage and their sacrifice, and that we do what they're asking. Number two is avoid crowds and gatherings, no exceptions. And, you know, I see different ways that people are trying to still do things they did in the past and try to innovate different ways. Folks, if it's not virtual or on the phone, let's not try to be the exception. Let's try to do everything that we can to increase our social distancing and to make sure that we are defeating this virus. Number three is practicing social distancing. That means when you have to be somewhere, being 6 feet apart. That doesn't mean going somewhere so you can be with people 6 feet apart. It's when you happen to come along somebody. Number four is when to seek care. Remember, if you're nervous but healthy, call the coronavirus hotline. If you are sick but would have not otherwise sought care, call, don't go to your primary care physician. But if you are truly sick, then yes, seek care, or if you are injured. kycovid19.ky.gov, that is the resource to go to for various guidance. Washing your hands and surfaces. Remember, we got to do it the right way. We got to do it the right way every time. Let's keep that up. Apply for benefits. We're going to have an update on that from Josh Benton today. You may have seen some news that I think we are number 10 right now in increase in unemployment across the United States. That doesn't mean that we have more unemployment. It means we are processing them faster than most other states. Now, we have so many people that need help. And I know what Josh will tell you is we're working as hard and as fast as we can. I know we're working harder and faster than other states, but that's not an excuse. If you are waiting and you are anxious, then it is not an excuse. We will work harder and have patience with us. We will get there. Prioritizing your mental health. We don't just want to be able to eventually come out of this. We want to come out of it strong. And we know, because we look at those Philadelphia and St. Louis graphs all the time, that we have to be strong enough, resilient enough to do this as long as it takes to defeat the virus, knowing that there can be that second bump that takes people we love away from us. Do not travel. James, do you have that new map from Christian County that they sent to us? If you can look for that, we'll pop that up when it's ready. Just another example of whether that's from other states or even other counties. We should be staying at home as much as possible. Only places you ought to be going are work, to get necessary supplies, or to care for a loved one, or pursuant to a court order if you have visitation for your kids. Finally, report non-compliance. If there are areas out there where we need to help, that's something that we want to do. Now, we always talk about the top 10, but here it is. This is as of April 9th, and it shows us not just neighbors to the south, but neighbors to the north. What it shows is that we need to make sure that not only are we not traveling at all, but the risks to traveling to other states that right now have a more significant coronavirus outbreak than we do. For those on our southern border, this was put together by Christian County, but whether it's Simpson County or others, there is significantly more concern and counties to their south. Yes, they are more densely populated, but what you do if you go there is you bring every contact back. That's why we have our no travel order to other states. So we talk about the top 10. We also have the 11th, which is fill out your census. We are doing better as of 2 days ago than every other southern state. That's not enough. Let's do better than everybody else. I mean, we have come together in a way that I think is special. I think sets us apart. I think makes us number one, and the commitment that we have had to defeat this coronavirus, if we can transfer it to this, it's going to make rebuilding a lot easier. So if you haven't done it, please do it. Now, the other thing that I ask of everybody each and every day using our hashtags, Team Kentucky, Together KY, Patriot, and Healthy at Home, is to model the behavior that we need to see. One of the reasons that we are flattening the curve, one of the reasons that we are saving people's lives is you haven't just bought into it. You do feel like it's your duty, and I am eternally grateful for that. I think I am the luckiest governor in this country because of what you've been willing to do and how you've absorbed it as our collective duty. And this is one of the reasons. This is one of the reasons we've had more and more and more people get on board, because you've almost shown your joy in doing something for your fellow man, that passing the test of humanity is something that we can be proud of. So every day we show a little bit of what you put out on social media because it encourages other people to do the same. So let's look at what we have today. Oh, I think this is pretty special. It's one of our teachers and coaches, and one of our, I think, a PE teacher and coach saying hi to her family, which again is hard. And we're going to talk about senior care facilities, which are being hit especially hard, but how important this is right now. This is, again, another example of doing those things together as a family. We've talked about trying to make the most of the moments, spending time. If you're lucky enough to be in a stable home with your kids, not only helps them, helps you. It helps my anxiety. So let's make sure that we do try to take those moments. All right, so I've been saying over the past couple days, no house parties. That if you have people that come over to your house, you spread the coronavirus, and you probably think it's innocent, it's just one other couple. You may even say in your mind, well, we're the only two couples that are going to get together during this period of time and let our kids play. We cannot do that. That's how the coronavirus spreads. But you know what? These guys, these folks, not just guys, showed us how we can do a house party. And that's by Zoom. That's by FaceTime. They figured out that you could still see each other. You could still enjoy it. And so I want to thank them for showing us how you can still have that connection with people without being physically together. You know, I've been asked a number of questions about churches that aren't complying the last couple days. But let me say, I mean, the real story here in Kentucky is how many are, is how our faith communities of all faiths has come together and recognized what is so important for their flocks and for our fellow human being. And lighting up green each night, I think, is just one example of that coming together. Now, let me say that our faith community is leading, absolutely leading during this time. I couldn't be more grateful, and I couldn't be more proud of our pastors, of our ministers, of our rabbis, our imams, and our deacons, and everybody else for not only recognizing what we need to be worshiping at home, but all the other services that our churches do and houses of worship do, because there are so many. I'm going to talk about Easter and Passover here in a little bit, but I want to recognize everything that they are doing. And this is actually a member of the media taking a picture in Pikeville. And if you've ever been at events in Pikeville, you know that this is a pretty special place where a lot of them happen. But it's what he wrote. that hit me. You know, when you have kids my age, you have seen Finding Nemo and the second one, Finding Dory, and that comment, just keep swimming, really hit me. It's a keep going, keep doing it every single day, knowing that if we keep going, we will get out of this. But waking up every day, and whether it's thinking just keep swimming, let's just keep working, and let's just keep working. City of Russell Springs, again, honoring those that we have lost. We're seeing this all over Kentucky. It's just an example of how united we truly are. J.D. Shelburne. You know, I think about the short time that I've been governor and how different it seemed to have been before and then after this coronavirus. I got to meet J.D. Shelburne, a Kentuckian, a rising star in Nashville when he agreed to be on the cover of our tourism travel magazines. He did a press conference with us in the Rotunda, wrote a new song about Kentucky, which is great, and now is going to be doing a concert to raise money for our Team Kentucky Fund. He is a great guy. Admittedly, I'm very jealous of his hair because he has a lot more than I do. I just hide it pretty well, but appreciate this was him being very willing and wanting to do it. So let's talk very briefly about our commitment and our recommitment every day. And because of the job you are doing, I think there is no question that we are better protecting people around us. You know, when you look at us versus other states, the data's a little older, but I'd like to see the line graphs again that are adjusted per population. We are working really hard each and every day to make sure that we better protect our people. Whether it's this graph, which you can really see the difference, or this one, does show, even adjusted for that population, that what you're doing makes a difference. And this is the good news, and there's some tough news too about where the coronavirus is spreading, just like it is across the rest of the country. But I give this to you for encouragement. I need you to keep it up. You know, there's a lot of talk nationally about are we at the peak or what are the plans for X and Y. We are nowhere near out of the woods when we look at today. And so I want us to continue to want to be one of the most successful states. Got a call from the Vice President last night. I was talking to him about personal protective equipment, and one of the things he said is how effective that we have been in Kentucky because their data shows what everybody else does, even when adjusted for population or any other number. You are doing a great job. But every day that we lessen, more people are harmed. And every day we do more people are protected. So I show this for encouragement, hoping that it just makes you want to do all that much more because every decision you make matters. I said this before, but it's the only crisis that I can think of in my lifetime where the decisions of every Kentuckian, every individual truly matters about how many people are saved or how many people are harmed. So remember, you can be a hero in the midst of this too, that while it doesn't feel like it, you have more control on it than just about any other crisis we've faced. So continue to make those good decisions, and we will continue to see graphs like this. Let's just show the KY code, the Act Now, just as a reminder. You know, as we see, as I have to come up here and report deaths every day, and we'll report some today. I will tell you it's something I wasn't prepared for when I became governor. It's one of the hardest things that I do. But what we know right now is we are reducing them. And these are all projections, and we can't tell you how much, because and we'll be able to give you some projections when this is all over. But again, what we know is that we are saving lives, all of us collectively. This just being one example of, at least at the time when they were made, how many people we can save simply by following the guidance. All right, I want to go into a number of updates, have a decent amount to cover today. Number one is we've had to make the tough decision to close Natural Bridge State Resort Park and Cumberland Falls State Resort Park. Again, we're trying to keep as many of our state parks open for people to hike and get outside and get exercise. That helps with physical, emotional, and intellectual health. But where we have seen crowds gather in a way to where we know that we have to take action in those individual places, we are taking action. So folks, let's make sure that we're not using state parks to congregate, and everywhere that we see that, we'll have to continue to take action. As you know, we have no overnight guests at any of our state parks, and our campgrounds are closed for that too. The only people right now that are staying overnight at our state parks are healthcare workers, are first responders that need a place to self-quarantine or want to be there so that they're not potentially bringing something home to their family. I know that has helped in a lot of places, but our job is action. Our job is to wake up each and every day, just like our county judges that requested this, and think about how many more things can we do to help people. Second piece is we have a new executive order on workers' comp, and for that we have my Chief of Staff, Latasha Buckner.
Okay, so for once I'm here not telling you what you can't do. I'm going to give you some good news. We have a new executive order, and what it does is allow for temporary total disability payments to more categories of workers than were available to have access to this before. And this is a group of people who are on the front lines as well. Previously, first responders, healthcare workers, EMS firefighters, people who had COVID exposure and were required to be quarantined by a healthcare professional got a percentage of their pay when that happened from the workers' compensation insurers plans. Now we have a larger category of people who are required because of their jobs to have a lot of interaction with other people. And because of that, they're at a higher risk for COVID exposure. So if you're in these categories and your healthcare professional says you've got to be quarantined, you're not actually sick necessarily, but you've had exposure, you're going to get access to these benefits. Those categories are workers in childcare, grocery, postal service, domestic violence shelters, child advocacy workers, rape crisis centers, active National Guard, military, corrections officers, and social workers. So now if you're ordered to be quarantined, you don't have to go through the long process that was required before. You can start getting the benefits at the beginning when you really need them. And then at the end, the employers can still try to oppose that claim and deny the benefits. But until that's finally determined by the workers' compensation people, you're going to at least get the benefits through that point. Thank you.
Thank you, Latasha. She will likely never get enough credit for the long hours that she is putting in through this, but we could not be doing what we're doing without her and so many other people's work. Next is an update on unemployment from Josh Benton.
Thank you, Governor. Just going to give a couple of updates on numbers of claims and payments that have gone out, and also talk about
that's true. Yeah. And it's probably another part of my employer that's not like that. You don't want to do it. Right. I was trying. Let me worry about it. Allegiance jacket, shoot, jacket.
So we're ready? Okay, let's do this.
I've been going out of here. I just went out. Oh, yeah, yeah. You guys have it. I actually have it. What's open? Well, I walked down the whole thing. Where's that up? Just walked down Pennsylvania. Yeah, Pennsylvania, and then it's like where the Chick-fil-A is on the GW campus. It's like the road branches like that. It's right there. Chick-fil-A's open. Hot dogs at 6. Yeah. I just haven't. But it's nice to have one. Oh yeah. I've been saying out there for years for a walk. Gotta be easier for them to do. That's right. Go out to the range later on.
They say you should cover your mouth, your nose, and your ears.
I never thought about that. You're right. See no evil.
And your any goggles too.
Yeah.
Fully covered.
I'll wear my reading glasses.
Your reading glasses? Yeah.
You haven't heard though.
Actually, I'm not listening to anything. I feel why you're talking about. No music, no shit.
Yep, got your knee. That's all right. Sign pick up. Yep. Yep, I'm a fire. All right, so I mean.
Now you're ready.
And you just never know how long these are going to be.
Yeah.
It's kind of hard to sit and stand. You know what?
You don't know anything.
Don't know what you think about it.
It's going to be delayed.
Headphones. I got a lot in my pockets, so it's kind of like one of those like games.
Then you have too many pockets. When I wear jackets, I have some on my
I don't know what
sides.
the reasoning was behind this jacket today. It was the purpose originally.
Where are you going to put it? Oh,
Mostly head on. Oh, right.
Well, today tomorrow's supposed to be chilly. 10?
So I mean, it might not start on.
Right.
So it'll be beginning.
Once you're good with this, I'm gonna be good with this.
No, okay.
Thank you so much.
If you are, here. That's a perfect reason.
Sorry, did I get you? Did I get you?
Thanks, my brother.
Five, this is your briefing room, once you get to five.
Thank you.
We're not allowed to hug each other, son. Yeah, I'm gonna go for my time.
Hey, Jim, you guys are not the people there? Go that way if you want. Hey, Jay.
Hi, Kara.
Hey, Kristen, it's fine with me, but if you want your pass changed or just
It's on now.
What?
Jim, give it more if you want. Just keep letting it stuff. Good, thanks.
Okay. Is far enough over, Jay?
Yeah, you look good.
Okay.
Hey, Phil, I got you.
Oh, it's not gonna be short.
Thank you. Hey, what is the plan if this starts in the middle of my package?
I will, yes, I can. I am in the briefing room.
That you
I guess so.
really are,
There haven't
Yeah,
been
no problem. I'll make sure
results. They
it's-
said
Yeah,
no
absolutely.
releases
I just wanted to
good
say
yet,
thank you.
so. And I did not have X minus there when I was talking to the board, but I guess this is what we're doing. Anyways,
Oh, look at you. So fancy.
The briefing will begin at 6:30.
Yep, 6:30 briefing. 6:30 briefing. You guys want to still do it in here, or do you want to go out to the north lawn? I guess since we're here, we're here.
We're used to
Thanks, Phil.
It's like a fine bell.
Just stay here, okay. Might as well. I bet it, I think it's because of these results, that we haven't been told. Nobody's been told anything.
Jim, just go to your right, like that.
Mhm.
Perfect. Perfect. That's great.
Okay.
Thank you.
Hey, Charlene. Okay. Yeah. He's off 6:30.
Good evening, Brett. For the very first time tonight, in order to be in the room for tonight's briefing, you had to get one of those rapid coronavirus tests. And these are the same kinds of tests that are going to be absolutely critical to reopening the economy. And just this afternoon, the White House's top economic advisor, Larry Kudlow, said he believes that that will likely happen sometime within the next 4 to 8 weeks.
That's right, Wolf. First of all, we should point out that we were just told in the last few minutes that the coronavirus task force briefing has been delayed until 6:30. But in the meantime, you're right, White House officials are telling us that they are working on plans to set up a new task force aimed at reopening the U.S. economy. But the big obstacle that stands in the way is that the administration has yet to put in place a nationwide testing system to make sure Americans are safe to go back to work. Yeah, I didn't have mixed minus there, guys, just FYI.
Now, at least part of
I
the
can hear
reason
myself
that this
talking.
briefing has been delayed is because we're told President Trump either is on a conference call, or he was on a conference call with Russian President Vladimir Putin and the King of Saudi Arabia, discussing a deal to end the oil price war between those two countries. So we are now told that this briefing is set to start at about 6:30. Clearly a lot to ask President Trump when he steps into the room tonight. Brett. Thanks for getting me that.
You're welcome. So, not as, reason why I wanted to chat. I will just unplug this. I hope this is gonna. Okay, you can just put this next to you on the end of the seat.
Okay.
And it's a new day in the White House briefing room. Earlier this afternoon, the White House doctor's office asked that all correspondents and technicians who work with the various networks, reporters who work for various news outlets undergo the coronavirus test. They did this earlier this afternoon. Wolf, we have not gotten the results back yet, but we were told no news is good news, meaning that if we're testing positive for the coronavirus, then we will be notified. And while we're grateful to get this coronavirus test, Wolf, it makes you think about all of those Americans out there who would like to get the coronavirus test but can't get one. Wolf. Essentially, Wolf, it's sort of what we've been hearing about from a lot of other people. They inserted a couple of swabs into both of my nostrils, and it was a little bit uncomfortable. I won't lie to you, but it was over in seconds, and we're told that the results should have come back within 15 minutes to half an hour. And at this point, we just haven't heard whether or not they've cycled through all the test results for all the people who are going to be in the briefing room this evening. We assume that's part of the reason why things are being held up. We know the president is also on the phone this afternoon with Russian President Vladimir Putin, King Salman of Saudi Arabia. We're told that's another reason why things have been delayed. But no question about it, it's an uneasy feeling to undergo a medical test at the White House just to cover a briefing. That's right. Okay, see you guys.
actually, if I get you to be right about where he would, yeah, he probably is a little closer. There we go. Thanks, sir.
We don't need it longer today.
I know. Richard, it's Daniel with Politico. Hey, good, how are you? So I called Richard, he said I should call you. I was wondering about these two people who, were being brought on. I was just wondering what positions they were for. This is Jennifer Arangio. And sure.
Go a little earlier.
What's AA mean? I added to it. They were to raise it, yeah. He's like, hey, I'm directing. Yeah.
Again?
Just sitting down now.
Oh, okay.
Yep. I'll email that. Yep. Thank you. Thank you. Take care. Bye.
You've taken pictures before.
The briefing will begin in 60 seconds.
That's right.
I did it on purpose, I can stay awake.
During the second hour. If you close your eyes for a second, they'll make it look like you slept through the whole time.
You can't win.
They do it to me all the time. Just. And did you know they gave us 10?
Thank you very much, everybody. I'd like to begin by saying that we just completed a meeting with the Secretary of Treasury, Steve Mnuchin, and Secretary of Transportation, Elaine Chao, on proposals regarding the airlines and the airline business. And we're working very closely with a lot of different people. We'll be probably putting out a proposal and giving them some of the details, some of the very powerful details over the weekend. It's moving along quickly. The airline business has been hit very hard, as everybody knows, and we are going to be in a position to do a lot to help them so that they keep their employees and they save their businesses. And that'll be taking place, I think you can say, over the weekend. We may even have discussions with some of the airlines or all of the airlines over the weekend. And I think it's going to be a very acceptable package. It's a very big package and a very acceptable package. It'll be good for our country, good for the airlines, good for a lot of people. Likewise, I just spoke with the president of Russia, Vladimir Putin, and the king of Saudi Arabia, King Salman, and we had a big talk as to oil production and OPEC and making it so that our industry does well and the oil industry does better than it's doing right now. It's the numbers are so low that there'll be layoffs all over the world. There'll be certainly layoffs in this country. We don't want that to happen. We built a great energy business in the United States. So we have tens of thousands of jobs. We had a very good talk. We'll see what happens. But as you know, OPEC met today, and I would say they're getting close to a deal. We'll soon find out. So that was a conversation we just had. So we had a busy hour and a half. And let me begin by expressing my sincere gratitude to the American people. Millions of Americans are making profound and difficult sacrifices in their own lives because they know it will save the lives of countless others, and that's exactly what it's doing. You see what's happening and where we are, where we stand, and hopefully we're going to be opening up. We can call it opening very, 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 very soon, I hope. Together, our people are writing one of the most noble chapters in the proud history of our nation. Americans are also encouraged to learn that Boris Johnson, Prime Minister, has been moved out of intensive care. That's a tremendous statement. And we continue to pray for him and his fast recovery. That's a very, very positive development. As the New York metropolitan area continues its battle against the outbreak, the full power of the federal government is there to support them. As you know, the Javits Center has now been fully converted. Very, very, very soon, I hope. Together, our people are writing one of the most noble chapters in the proud history of our nation. Americans are also encouraged to learn that Boris Johnson, Prime Minister, has been moved out of intensive care. That's a tremendous statement. And we continue to pray for him and his fast recovery. That's a very, very positive development. As the New York metropolitan area continues its battle against the outbreak, the full power of the federal government is there to support them. As you know, the Javits Center.
Okay, it is just not true to say that the full power of the federal government is supporting New York or any state. As has been repeatedly flagged, the federal government has not been able to provide as many ventilators as New York believes that it needs, or masks or other personal protective equipment. Currently, there are about 4,600 New Yorkers on ventilators. Governor Cuomo is concerned that we could soon be out of ventilators and that doctors will have to choose which patients live and which die.
With protective equipment, Project Airbridge continues to expand with more than 24 flights already completed and 49 additional flights now scheduled in the near future. So that's been very successful, and that gear and those outfits are being handed out. As they arrive, they're going directly to point. The American medical system continues to perform beyond our highest expectations, reminding us that the United States is blessed with the most advanced health care and the most skilled healthcare workers anywhere on the planet. Other countries are looking to what we're doing, and our testing operation has now become far and away the most sophisticated and the best anywhere. And we want to thank all of the heroes or the front lines as they fight.
Okay, it is simply not true to say that our testing is the best anywhere. In terms of testing people per capita, we rank about 41st in the world, and a Washington Post report from yesterday highlighted that there is still not a national testing strategy, and governors from multiple states are complaining that they do not have the equipment that they need to perform the tests. Even if they have the tests themselves, they don't have the basic elements. They don't have enough of the swabs needed to perform the tests.
Physically apart, no American is alone, and we're all in this together. But the mental health doctors and experts, it's a very great call. It was a very interesting call. They're working very hard. We're also seeing encouraging signs in our race to develop breakthrough treatments and therapies. Pfizer revealed today that it has found a promising new treatment that might prevent the virus from replicating, and that it hopes to begin testing in clinical trials very soon. It's going to be very, very soon. They have great feelings for this particular therapy, and they think that a lot of good things are happening through the FDA's Coronavirus Treatment Acceleration Program. 19 therapies and treatments are now being tested, and 26 more are in the active planning or clinical trials. So we have 19 therapies being tested currently, and 26 more are in the active planning for clinical trials. That's a big statement. That's a lot. Trials for...
Okay, what he's just said about some of this testing is false. That testing is scheduled to begin this fall.
Getting good early results, by the way. The companies that manufacture hydroxychloroquine are massively ramping up production. As you know, many people are recommending strongly Z-Pak be added, the Z-Pak.
Okay, so the president just keeps doing this thing with hydroxychloroquine and also Z-Pak. Hydroxychloroquine has not been shown to be an effective treatment for the coronavirus. There just simply is not the evidence. There are some very dangerous side effects. President Trump has recklessly urged Americans to start taking it on their own, even suggesting that he might. It has potentially lethal side effects, and also there have been reports that he has financial ties to at least 2 of the companies that make it.
Milestone for our country. It's a milestone anywhere. Nobody's done anywhere close. Our tests are highly sophisticated and highly accurate. At the same time, we're making important progress on the economic front of this war. In a few moments, Secretary of Labor Eugene Scalia will explain new steps.
The president says that we are making important progress economically. This comes on the day when we've had another earth-shattering number of unemployment claims. 6.6 million new unemployment claims this past week. That means that over 16 million Americans have filed for unemployment in the last 3 weeks. That is more than in the first 2 years of the Great Recession.
1,000 employees, and $500 billion will be available for states, counties with over 2 million residents, and cities with a population of over 1 million. My administration is also working with Congress to replenish the very successful, incredibly successful, the way it's going, Paycheck Protection Program, which is allowing hundreds of thousands of small businesses to keep their workers on the payroll, meaning it'll keep those businesses open. We need both Democrats and Republicans to come together to get this legislation completed, and it looks like it's on its way, but we need both, and it should be for people that are working, for the workers. And if you look and you see, we have a lot of people that are affected by that, and it's a very positive development, so we have to get a bipartisan approval of that, and hopefully that'll happen today. The Department of Education is also announcing the availability of more than $6 billion in emergency grant funding to assist college students impacted by the cancellation of classes and the suspension of housing. A lot of people had a lot of things suspended. Housing is one of them. Previously, we waived student loan payments for 6 months. So student loan payments have been waived for 6 months. So we'll discuss it after that. May go further. Although this medical war has separated our citizens for a period of time, it's also united our entire nation. I think I can say like almost never before, Americans are moving forward with.
Now, the president is talking about unity. It is striking. Whenever he is reading from his scripted notes, he talks about unity. And when he is speaking off the cuff, he starts attacking people. Reminder, his last tweet was attacking the Wall Street Journal as fake news and complaining that he wasn't getting enough attention for the great television ratings of these briefings.
Airlines. Yeah, please.
Conversation with President Putin and the King.
Yeah, I had a very good conversation.
Did you organize that call, and do they understand the problems they're causing with
Yeah,
the oil output?
yeah. No, there's so much production, nobody even knows what to do with it. That's how it's working. And Saudi Arabia, and as you know, Russia, it's well known that we're producing a lot, and they were perhaps fighting with each other over the production and the amount of oil being produced, and frankly, there's not enough room to even store it. Our storage is now full, going to be very soon. Our strategic national storage is, I said, this is a great time to fill it up, load it up with oil that frankly is at pricing that nobody's ever seen before. I don't think we've seen this probably since the 1950s. That was with big dollars. So we'll see what happens. The conversation was very good. They're getting close to a deal. That's OPEC and many other countries outside of OPEC, and we'll see what happens.
By the way, if you're ever looking for a very destructive drinking game, when the president says, we'll see what happens, if you take a shot, that'll probably mess up your night quite a great deal.
Not so good, but I think one way or the other. Go ahead, Jim.
Mr. President, how could the administration discuss the possibility of reopening the country when the administration does not have an adequate nationwide testing system for this virus? Don't you need a nationwide testing system for the virus before you reopen?
We have a great testing system. We have the best, right now, the best testing system in the world. But there are certain sections, there are certain sections in the country that are in phenomenal shape already. Other sections are coming online. Other sections are going down.
Okay, I just want to tell you from personal experience. I'm here in New York City, the epicenter of the global pandemic, and we can't get tests here. My wife is recovering from symptoms of what very much seems to be that it could have been the coronavirus, but because she is not deathly ill, we can't get a test to find out. It is simply not true to suggest that Americans have access to widespread testing.
About 325 million people, and that's not going to happen, as you can imagine, and it would never happen with anyone else either. Other countries do it, but they do it in a limited form. We'll probably be the leader of the pack. Please.
What do you say to the 16 million Americans, more than 16 million Americans who have lost their jobs in the last 3 weeks, and fear that the economy won't just bounce back, like you said?
Well, I think the economy is going to do very well. Now, that's just my feeling. It's a strong feeling. I've had good, proper feelings about a lot of things over the years, and I think we're going to do well. We're doing very...
It is important to note that President Trump's gut feelings about things over the years actually have not served him well. Most of the businesses that he has run have failed, and he has very famously made predictions that, for the most part, have not come to pass.
20,000 to 220,000, or if we did nothing, up to 2.2 million people. We're looking at a much lower level than the level of, I hope, than the level of 100,000. So we're going to see. We're going to have to, you can never do anything about the people that lost their loved ones and lost their friends, and I mean the great friendships. And I'm not sure a lot of people will ever be the same. But I think our country, from an economic standpoint, will end up being stronger than ever. We have tremendous stimulus. We have tremendous stimulus plans. We have things in the works that are going to really, I think, fire the country. I think that what's going to happen is we're going to have a big bounce rather than a small bounce. But we will be back. And I think, honestly, I think our country is going to be back from an economic standpoint. Again, you can never replace the people that were lost, and to their families, certainly you can never do a thing like that. But we will have succeeded in many ways.
Okay, so there's several things going on here. The president is trying to frame anything short of 100,000 deaths as a success. The fact of the matter is, to date, more Americans have been killed by the coronavirus, there have been 5 times the number of deaths as from the 9/11 attacks. So it is hard at this point to call anything a success, especially as we know that the president and his administration were briefed about this potentially as early as last November and did not take any form of decisive action until March, and still do not have a nationwide strategy for testing nor a nationwide stay-in-place order.
And what happened is the virus knocked out 40% of the market. Immediately, you know that, you know the number, 40%. Now, there was a lot of oil, but it was very controllable. All of a sudden, they lost 40%. You look at the roads, you look at the car, you look at what's going on. There's nobody driving. There's no reason for it right now. That'll start coming back. But we are storing millions of barrels of oil that nobody thought would even be possible. Frankly, ships turned out to be a good business for some people because they're filling up tankers, sending them out to sea and not saying where to go. They're just sitting out there loaded up with oil. So we want to save our energy in this country. We want to make sure that our energy companies, businesses, and employees, workers, remain strong. So that's how I'm involved. And I think that's going to happen. So right now, if you look, you're probably talking 23, 25. If they announce a deal, we can get it up. We need a minimum number so the companies don't go out of business. So they're not going to lay off all of these energy workers who are important to our country. And, you know, we're now energy independent. We could do something where we only used our oil. But I think the long-term benefit is to be able to just go with the market. And it's going to work out. It's all going to work out. If you looked at 3 weeks ago, as you know, because we talked about it, 3 weeks ago and 2 weeks ago, this was catastrophic. I think it's really hitting bottom, and I think that, I mean, we've had a bottom, but now at $23 and $25 and probably heading up. At the same time, we save our energy, and we also produce great, cheap energy, and we save our jobs. Yeah.
I want to ask you about the Paycheck Protection Program, because every day we're hearing from small business owners who are telling us that their banks don't know how to access this money. They're trying to apply. They can't figure it out. So where does the fault lie? Does it lie with the banks?
I don't think there's a fault. They're doing record numbers of dollars. They're dealing with many community banks. They're dealing with Bank of America, Citibank, a lot of Wells Fargo, as you know, is very much involved. And they're dealing with the bankers. Can't go that quickly, but I'm hearing it's a very, very successful rollout.
Well, the president is overstating the level of the success of the rollout. Website failures have put a roadblock in a lot of these loans, as has an unwillingness of banks to lend to new borrowers, that is, borrowers who don't already have existing business with the bank. And other banks have just been so overwhelmed that they have not even been able to process the applications for loan.
Well, we have a deal. Yeah, the deal is with Canada. The deal is with Mexico. We have a deal. And obviously the deal is different from the standpoint that production will be lower. But we have a deal. It's a signed deal. It's a deal that's one of the worst deals that we've ever had was NAFTA, one of the worst trade deals ever made by any country anywhere. We'll be terminating that. And the new deal is a great deal for our country. So.
Actually, the president is overstating the differences between the New Deal and NAFTA. There are definite improvements that people from either side of the aisle can agree upon are better about this New Deal, but in many key respects, it is more accurate to describe it as a new NAFTA than something totally different.
Eating less from the standpoint that there's no restaurants are open, no businesses are open, no hotels are open. They'll start to come back, but we're going to be helping out our farmers. Yeah, please.
The new Thank you, sir. Philip Wegman, Real Clear Politics. Earlier you mentioned Project Skybridge, and we're hearing that through that project, a lot of the PPE that was sent out to other countries is coming back to this country. Do you know when we will be able to bring a majority of that back? And then are you frustrated that USAID allowed a lot of that aid to go out the door in the first place? Should they have brought it back?
No, I'm not, because we're in very good shape. You'll be speaking with Mike Pence